Those in the health sector have announced that more than 350 billion Rwandan francs are needed to reduce by 25% deaths that occur as a result of non-communicable diseases by 2025. Nuriat Agasaro has this report.
Non-communicable diseases such as respiratory, heart, diabetes, high blood pressure, cancer and other are the cause of death of about 30% in Rwanda. Numbers Arias is a kidney patient who has formed an association, and Philippa Chibugu, a breast cancer survivor, and she's campaigning against it.
Rwanda is a dream country. In 28 years, we did not have the resources that are necessary for, say, for instance, we didn't have the Rwanda Cancer Center. I get biased because this is what I focus on. But it is doing, it's everything. They have educated, we have more skilled manpower, and others are also going. We have interest in having a strong country based on better health. You can't be strong without strong health. So a lot is being invested in health and awareness.
I participate in these physical activities. They help me to reduce because I have the problem of high blood pressure. So when I participate in those physical activities, at least it maintains the high blood pressure is maintained at normal level. But when I don't participate, that's when there is a high blood pressure.
According to Dr. Evarist Ntaganda, who is in charge of NCDs at Rwanda Biomedical Center, says statistics show that in Rwanda, diabetes has reached 2.9%, blood pressure has reached 16.8%, heart disease has reached 3.2%, and smoking, the main cause of respiratory diseases, has reached 7%. He says that those diseases can be prevented for free because some of the medical services are close to the people.
We have now done decentralization of NCDs, depending on the severity of disease. Of course, you are not going to, if you can treat hypertension in the health center and diabetes, you are not going to treat like cancer of advanced stage in the same facility. So they didn't go to other levels like provincial hospital or teaching hospitals, or even like King Faisal. You have seen people who come for open heart surgery. The service is still growing. We need more efforts to be put in because we have so many people. Long list of people need surgery. So, but at least there is a trend that we are taking in terms of fighting non-communicable diseases.
From 2020 to 2025, Rwanda will need over 350 billion Rwandan francs to reduce death from those diseases by 25%. Professor Joseph Muchumbisi, Chief Consultant Pediatrician and Cardiologist and Director of the 26 organization that monitor the problem of patients with non-communicable diseases, says that Rwanda was rewarded by the United Nations in its 77th General Assembly, which recently held a meeting in New York, United States.
We are ready to continue to work with the government and the RBC NCD division to continue working for the implementation of this national strategy, which has an ambitious target of reducing by 25% the number of deaths due to NCDs at the horizon 2025. It is an ambitious target, but with a high-level coordination committee for NCDs, with a technical working group for NCDs supporting it, and with the involvement of the private and public sector, we think it can be done. And we are ready to play our role as the civil society representing people living with NCDs so that it becomes a reality.
Smoking, poor diet, heavy drinking, lack of exercise, and air pollution are some of the causes of the non-communicable diseases. More than 17 million people worldwide die from those diseases each year, despite the fact that the world aimed to reduce the number of deaths by 50 million by 2030 and needs more than $8 trillion every year. Nuriat Agasaro, RTV News.